conversation point here on the Urban Debate. The battle against coronavirus. Today, the Prime Minister held his meeting with the state chief ministers to take a look and to discuss the way forward, where we are, how India is faring, and what should be the way forward. Now, let me very quickly tell you what Prime Minister's big message was. He said that 10 states are critical in this war against corona, 10 states with a high number of cases, which is where the big focus is right now. He also said that while many states are doing well in terms of high level of testing, states like Bihar, Gujarat, Uttar Pradesh, West Bengal and Telangana really need to step up on their testing. This is what Mirana has been highlighting. Some of the states, including Telangana and Bengal and Bihar, have been lagging behind. Prime Minister also mentioning Uttar Pradesh and Gujarat lagging behind when it comes to number of tests being carried out on a daily basis. He also said that the states need to ramp up on contact tracing, containment, surveillance, tracing and testing. This is the mantra that has been put forward by the Prime Minister to this country today. And I'll tell you why this is important, viewers. Just look at the basic data that we have right now when it comes to India's testing rate, where we stand versus the rest of the world. In terms of the 20 countries battling coronavirus, the big ones, the UK and US are on the top of the list with the highest number of tests being conducted on a daily basis. UK does 15 times more tests than us. US does 11 times more tests than us. Spain, Italy, Germany, Peru, Brazil, Colombia, all are performing better than India in terms of tests being carried out. We, in fact, are literally in the bottom of the list, perhaps only better than countries like Pakistan, and that's no great feat. Why is India testing so low? Is it because the state governments are hesitant? If we test more, the cases will be on the rise and then the questions will begin and pressure will rise. Is it because we still don't have enough testing kits 5 months into this pandemic? Why is it that India is still unable to ramp up its testing? If we don't know what is the extent of the spread, what is the extent of the investigation, how are we going to formulate any policy in this country for coronavirus, whether it's locking or unlocking, creation of health infrastructure, medical infrastructure, support staff, any kind of policy, economy, boost to the economy. It all depends on knowing what is the extent of this infection in our country. All of that boils down to how many tests are we conducting in this country. And so if we are in the amongst those carrying out the lowest number of tests, shouldn't we be raising an alarm? The government, central government, ICMR and the states need to look into this aspect. I have experts who will be joining us to explain to us further why it is so important for us to have a higher level of testing. Dr. Sunila Garg, Director, Professor at HAG, joining us this evening, National President-elect for IAPSM as well. Dr. Anant Mohan, Professor and Head of All India Institute of Medical Sciences, Department of Pulmonary Critical Care, joining us this evening. And I also have Dr. Velumany, Chairman and MD for Thryocare Technologies, joining us this evening. Dr. Velumany, you yourself, your own business has great amount of understanding in the kind of testing we are carrying out over there. Now, we may have come to a better place today than the level of testing we saw 2 months ago. But why is it that we are still keeping our numbers so low?
It's obvious. We are keeping comparing ourselves with the high per capita income countries where their incomes are almost 20 times higher than India. Having said that, government centrally has not advised all states first to complete at least 1% of the population testing. There is no directive. All state governments haven't spent adequately towards testing. Now, who will pay? Rich only can pay, poor cannot pay. Earlier, we were thinking if allowed, everybody will undergo testing. Today, after a month of it becoming open, not that everybody wants to go for testing. Probably everybody is scared. If I am positive, my colony will be quarantined, my floor will be closed. So there is a huge intimidation by the state administration for the positive cases. So it is fear, A. B. Those who want do not have money to undergo the testing. C. Government is not spending except couple of the municipal commissioners who have some funds. They are spending. Remaining government is not spending. No one is spending. If no one is spending, how is that testing can ever happen to the level which we desire to have?
Yes, okay, that's an interesting point that you're raising, that there is so much of intimidation, some amount of stigma. People perhaps don't want to come out and get tested, but at least the extent of contact tracing, immediate family, that area, that building, those who've come in contact with, we seem to be slowly falling behind even on that front. Dr. Sunil Agar, what's your own sense? Are we now becoming a little laid back 5 months into a war against pandemic, even though the numbers actually tell a very different story with the way we are seeing, the number of cases rise every day?
You see, one thing which I'd like to say is that the pandemic is really behaving in a different manner. And if you look at last month, we were talking the same thing about Delhi. So how Delhi, increased its testing, and simultaneously it also focused upon the containment, contact tracing and surveillance, and is now being quoted as one of the success stories. And the similar thing happened in Dharavi as well. So I look at the journey from Dharavi to Delhi as to how we have been able to contain the epidemic. But if we look at some of the states like Andhra Pradesh, Bihar, Gujarat, Karnataka, Maharashtra, and all the 10 states from which the representation was there for today's meeting. If you look at some of the states like Bihar, and if you look at Uttar Pradesh and all, where these states have also faced reverse migration. So primarily, it is also the systems which take up time, and this is where already Uttar Pradesh has responded in a positive manner by creating a state-of-art lab in Noida itself, which has got a larger capacity, and we are approximately doing now 7 lakh tests per day, and we hope to extend to 10 lakh tests per day. And definitely the mantra is containment, contact tracing and surveillance, which we are focusing on that. But gradually we have to see that exactly we also remove fear, stigma and discrimination. We do have to empower our communities as well. So each and every member of our community also should be capable of providing home-based care. So these are some of the things by which we can give a holistic response towards addressing this pandemic.
No, but I understand what you're saying about ramping it up, but it's been 5 months, and in 5 months, if we've not been able to put in a system and a structure to ensure that we go out there and carry out the test, then how are we ever going to get a hold on this pandemic, Dr. Anant Mohan, if new areas will keep popping up, if we are not able to carry out surveillance, if we don't do contact tracing at the right time? I mean, today the Prime Minister himself said that I've been told that the first 72 hours are extremely essential in carrying out, testing to limit the impact. But that's not happening. Tests are being carried out 4 days later, 5 days later. Results are coming out, even later. Is it because of the size of the population, the challenge is to simply ramp it up, or is it lack of will?
Well, I would say primarily it is the challenges of the country per se, the huge population. So we really cannot compare our situation with all the other European and American the countries in many ways. Although we have to look at it in the perspective of the last 4 or 5 months, how we have evolved. So the number of testing has definitely gone up in most places. Maybe it can be better at some places. Then yes, that is always scope for improvement, and it is always work in evolution. So we have to do it. There is no doubt. But at the same time, the number of testing should also be matched with many other things. So along with testing, it will have to be a quick response to that. So the contact tracing and the containment or the isolation has to be done together. So all these factors together will make an impact. So the aim of testing is to pick up the cases early. When we pick them up early, we will have to act early. So all that together will make a difference. But yes, it is a huge population, the geographics of this country, the economics of this country, the number of testing laboratories have increased markedly. It is not a it was not very simple initially. It was an RT-PCR test, which is not something which can be done everywhere, but the number of labs have increased significantly. And now the rapid antigen test has also come up. So we do expect that things will improve. Maybe there is scope, and we'll have to do it in a much faster manner in some places. So that one has to keep a close watch on.
And also, I like to add, if you
But
look
let me
at,
give two examples just off the top of my mind. Yes, Dr. Garg, I am coming to you. Let me give two examples off the top of my mind. One example is in the state of Karnataka, the other one Telangana, also Tamil Nadu. Until we actually saw a sudden spurt in cases in a couple of their big cities, their testing levels were very low. Tamil Nadu was barely doing any tests until, the pressure increased. We started asking questions, and suddenly there was overnight, within a week, a significant ramp up in testing. For Telangana, there was massive outrage, questions being asked every day of the government, state government, saying, why are we not testing enough? They weren't even giving permission to the testing private labs over there to carry out these tests. And then suddenly, when 3 months into the pandemic, they opened it up, they realized what the true story was. Similarly, Bihar and Bengal. I am not too sure it's simply to do with the infrastructure that we have or the scaling up. That may be true for the big cities or some of the smaller towns. But in some cases, we just didn't bother for the first few months. Yes, Dr. Garg, go ahead, please.
I will definitely look at, the system preparedness definitely takes time, and accordingly, the Indian response has been quite good, but it has been quite diverse also. If you will see Andhra Pradesh versus Delhi, Andhra Pradesh is testing 47,374 cases per million population vis-a-vis Delhi, which is testing 59,034 cases. But you see, on the contrary, we do have Bihar, where we have got 8,424, tests which are being done every day. So there is a substantial difference between Andhra Pradesh and Bihar. And also, if you look at Karnataka, Karnataka is also doing about 25,730 tests, per million population, which is almost half. But it takes time for the system to gear up. That is one thing which we have to remember. Second thing is that India is very diverse, very big, and also with different kinds of population, different literacy level, and different levels of systems preparedness. So these things are the ones which take time, in looking at our response. But you see, whenever we have a very proactive leadership and we have got regular, commitments to this pandemic, and regular monitoring and evaluation is being done, this will play a major role in addressing the pandemic in a very big manner.
Okay, so what should be the ideal level where we need to get to before we start deciding on our policies of just how, what has to happen next? Dr. Velumany, let's start with you. Basis the daily tests that we are doing right now, what number should we be targeting?
Number targeting, first we should do at least 1% of the Indian population equally distributed across the states and cities to make sure that we have a real picture of what is happening. Having said that, since I am representing the laboratory side, let me make a few things very clear. Today, we have no problem of what is the rate because we have found very powerful bargaining power with vendors. So, cost is not a problem. Speed is not a problem. We are reporting in 18 hours all the samples which we receive. Almost everywhere in the country, private laboratories are not doing anything beyond 36 to 40 hours delay. So there is unnecessary message across the media and so telling that RT-PCR tests take too long a time and rapid antigen takes too fast a result. So these both factors, the private laboratories have no challenge. I have a capacity of 10,000 swabs a day. I am not getting even 2,000 swabs a day, which I used to get 3,000 2 months back. I am representing all my private laboratory peers. We don't have adequate business in hand. So that means government is not spending, private is not spending. How are you going to ramp up the scales? Capacity is not a problem. We can double the capacity even a month's time. So it is the policy of the government and the motivation to the general public and making them to undergo the testing and minimize the kind of quarantine discomforts. And it needs motivation all throughout. Otherwise, you won't be able to see a big number.
I just want to again one more time highlight this data. The top 5 countries in terms of testing, of course, the ones with much far more developed health infrastructure, much better per capita income. The points that Dr. Velumany was also raising. UK 2.7 lakh tests being conducted per 10 lakh people, per 10 lakh population. Russia 2.1 lakh tests being conducted. US 1.9 lakh, and then there is Spain and Italy. On the other hand, these are the top. On the other hand, at the bottom of the pyramid in this list are Argentina, India, Pakistan, Mexico and Bangladesh. So technically, we are only better than Pakistan, Mexico and Bangladesh in the number of tests we are carrying out. Now, I understand that the direct comparison may not be fair because they are far more developed, they have better access to the facilities, but we also have a population which is, much bigger than theirs, and 18,000 odd tests being conducted per 10 lakh people in our country is just not going to give us an idea of what is the real situation and where we have to go. Now, the other way we can get an idea is also, Dr. Anant Mohan, the rapid tests that we conduct, the antibody tests or sero surveys that are conducted, sero surveys that are largely supposed to give us a sense of what's happening in one area or on a larger level. But even on that front, do you think we are doing enough? Some states are doing their own sero surveys, but after the first round in the national one, we haven't even heard from the government on that. At least as far as surveillance is concerned, can we not step that up?
Well, yeah. So serosurveillance is something that will give us the approximate proportion of the population which has been infected, actually. So that gives us an idea about the level of community spread, if you can say so. And the ICMR did conduct the surveillance a couple of weeks back. So yes, that also I'm sure is going to be planned, but that again will have to be planned probably at a more national level and not just at a sporadic level, because many, like you said, many states are doing it at their own level among certain clusters. But if we want to have a holistic approach, we will have to have a concerted kind of a approach, which also I'm sure will be coming up sooner than later. As far as the rapid testing is concerned, that also is something that is supposed to kind of complement the RT-PCR in a way, because the RT-PCR initially took time to be ramped up, the time factor, the cost factor. So this was something which can be used as a more of a point of care test and can be done faster. Although it has also got its limitations, it has got a limitation of missing quite a few. So the sensitivity of not more than 60 to 80%. That just means, although it is useful if it is positive, if it is negative, it means that you will still, if a high index of suspicion, you will still need to do an RT-PCR to reconfirm the fact. So all these tests are actually complementary, and probably that is what, but they have to be used in the correct setting. So in every setting, a rapid antigen testing probably would not be useful, but we have to work to add up all these together if we want to add up the testing facilities in our country.
Yes, Dr. Garg, if I can come back to you to the point that you were making about different states and about movement of people. We've opened up our state barriers, our district barriers, migration, reverse migration, all of that has happened, which obviously means that if the infection has now gone beyond the big cities, which is where we were seeing bigger signs earlier. In fact, that's where we've seen a jump in cases in states like Bihar or Uttar Pradesh. Now, to ensure that there is a concerted attempt to step up testing there, what will the governments have to do?
You see, government has to strengthen the containment strategy, number one, which will actually address all the issues, that will address containment, that will address contact tracing, that will also address the surveillance part of it. But at the same time, that will also, you see, when these healthcare frontline workers are visiting from house to house, they will also create a lot of awareness, and simultaneously they will motivate people to come forward for testing. So that is another important thing which is linked very closely to, or that's an integral part of our containment strategy. So this is where we need to look at, and we need to look at removing the stigma, discrimination, and we need to look at creating awareness so that people come forward. And also we need to kind of focus upon the management strategy. That means people who are suffering from milder infections can be managed at home. So these are some of the important things which I feel that they will also complement our testing part, because people are scared to come forward for testing because of the long drawn out process which is associated with, isolating the people. And it takes almost about 14 days, as of now minimum, but then 14 plus 14, 28 days. So that's where, and on top of it, these people are isolated from rest of the people. So I feel that it is very important to take out this whole issue in an integrated manner and address them together. So whether we are talking of, as I told you in the beginning also, India is very diverse. India is very big. So whatever is happening in Delhi, or it is happening in Dharavi, or it is happening in Mumbai, the same thing may not happen in Bihar or in different parts of Uttar Pradesh. So these are some of the things which we have to keep in mind. But as I told you, that Maharashtra, Tamil Nadu, Andhra Pradesh, Karnataka and UP, they are accounting for highest number of cases. But between them also there is a lot of diversity. If you look at Maharashtra, we are testing about 22,144, a little above the national average. Also we look at Tamil Nadu, which is doing 42,417 cases per million population. So these are some of the figures which we cannot ignore, and Andhra Pradesh is doing almost closer to Delhi, that is 47,374 cases. So, but all of this you see has to be complemented with isolation. Then we have to also speed up our management strategies. So these are some of the important things. But as I told you, Maharashtra, Tamil Nadu, Andhra Pradesh, Karnataka, they are they cannot be compared with states or the districts, I'll say districts of Bihar or Madhya Pradesh or Uttar Pradesh and all that. So some of the important interventions have to be kept in mind, looking at the state's infrastructure as well. So we need to work in a holistic manner. We need to activate the public awareness on as a mass movement strategy, and simultaneously complemented with the testing, which has got to be an integral part of our containment strategy.
Okay, I understand the point that you're making. In fact, while yes, perhaps there is no direct comparison between Bihar and Andhra Pradesh, but Andhra Pradesh too has a lot of, it doesn't have that great health infrastructure. What we did see was a great initiative being taken by the government. And the Andhra Pradesh government and the Chief Minister was one of the first to move in terms of ordering import of testing kits. And they brought in their testing kits from Southeast Asia, sent a special plane, chartered plane, got it in, and moved very quickly. Karnataka, that moved very quickly in the initial days with contact tracing, surveillance, immediately, tracing every single patient's, contacts of the last few days, testing all of them, then kind of got a little laid back. And 2 months later, we saw a massive spike in cases because the testing numbers were low, since they thought the cases are low. And I think that cycle just continues, and somewhere the governments and those taking these decisions on ground often get trapped into this system. But let me come back to the point that I had raised earlier and ask that to Dr. Velumany as well. Dr. Velumany, because you yourself have studied a lot of data and what it shows from the tests that your own lab carries out, do you believe that there is at least a need to do a lot more of these sero surveys and analysis of the test results that we are getting? How will we decide on policies if we are not too clear about what's happening out there?
See, unfortunately, central government is not conducting a large survey across the country covering a huge number of population. Some parts of Delhi have been reported, some parts of Mumbai have been reported, all have been reported. Very, very motivating that India has 20+% of antibody levels in major cities. My analysis across the country covering 2 lakh tests and covering 800 cities across the country says Indian population has 23% antibody, 23% of the people having antibodies in their circulation. It's very, very motivating. For every one dead man, there are 10,000 people who have been immunized by this virus silently, freely. And while everyone is awaiting for a vaccine to come, it looks like if we cross 40 to 45% in December, vaccine may be less relevant. Having said that, I have run it in my own setup, must be having some bias. It's very important. Government conducts across the country, covering all the states, districts, and cities, and comes up with a statement which will motivate all the industrialists and businessmen and even schools, colleges, when to open, how fast to open, or how to slow to open. Without zero prevalence study, we are in a dark hunting for some solution. According to me, this pandemic will have a end by March 2021.
Okay. On that note, I'm going to thank all of our panelists for joining us. I believe we need to definitely ramp up our testing. The states which are moving slowly in setting up the infrastructure, who are thinking about costs, need to relook at their strategy. The only way, viewers, we will know a true picture of what's out there is if we test more, is if we know that whether you and I have coronavirus or not, if we've had already beaten it, gotten the antibodies or not, as our panelists were mentioning. Any policy, economic, social, healthcare, infrastructure wise, any policy, locking, unlocking will actually depend on this. And yes, perhaps just to look at the number of positive cases on a daily basis is not the right way to go. We have to look at other factors. For example, our mortality rate. Our mortality rate coming down. The Prime Minister says he aims that it comes down below 1%. Right now, we're just below 2%. Our recovery rate seems to be improving. Then why are we hesitant in going out there and testing more aggressively to see, are we really out of the woods? Do we have the healthcare medical infrastructure ready that is required? Should we bring in more? What should be our strategy tomorrow if there is a spike in a certain area? Let's just ramp up our testing, and that will be at least a starting point for where we have to go from here on. As I thank my guests, I want to play out what the Prime Minister had to say today, specifically mentioning 4 or 5 states that really need to up their game when it comes to testing. Listen in.
साथियों, टेस्टिंग की संख्या बढ़कर हर दिन 7 लाख तक पहुंच चुकी है और लगातार बढ़ भी रही है। एक्टिव केसेस का प्रतिशत कम हुआ है। रिकवरी रेट लगातार बढ़ता जा रहा है, सुधरता जा रहा है। हमने मृत्यु दर को 1% से भी नीचे लाने का जो लक्ष्य रखा है, इसे भी अगर हम थोड़ा और प्रयास करें, बड़े फोकस में प्रयास करें, तो वो लक्ष्य भी हम हासिल कर सकते हैं। बिहार, गुजरात, यूपी, पश्चिम बंगाल और तेलंगाना, यहां टेस्टिंग बढ़ाने पर खास बल देने की बात हम लोगों की बातचीत में से उभर करके आ रही है।
Welcome back to the Urban Debate. There are a few important news stories, viewers, that I want to bring to your notice. And we're going to begin with a landmark verdict that's come in today from the Supreme Court. A verdict that enables every single daughter in this country to have the same right as the son when it comes to family matters, to family property. Now, as you all know, viewers, our country did change the law in 2005 to say daughters will have the equal inheritance right to property as any other child. But the verdict at that point of time said that that will only be applicable to cases where fathers and daughters are alive when this change was made in law, which is in 2005. That thing has finally been changed now. Meenakshi Bhanja joins me with more on this case and what the Supreme Court has ordered, a step closer, a great victory when it comes to gender equality in our country. Meenakshi, once a daughter, always a daughter, says the Supreme Court.
Well, definitely, Tanvi, this will be seen as a step in the right direction. And just like the triple talaq judgment of the Supreme Court was hailed as something which enhanced the rights of women in this country, likewise, this judgment will also fall in the same category, like you actually mentioned, which goes on to accentuate the rights of the women insofar as gender equality and gender justice is concerned. The Supreme Court today rejected the argument that daughter will get compulsory right only if the father is alive as on the date of the coming into force of the Hindu Succession Amendment Act, like you rightly mentioned, of 2005. Now, compulsory right, Tanvi, is something which is joint ownership rights. Therefore, this judgment is quite reformist in the sense that this is putting a daughter's right on Hindu undivided family on the same keel as the son's right. And that is very significant because the Supreme Court has also today, in this judgment, dwelled on the historic origins of Hindu law. And I'm quoting from one excerpt of the judgment here, Tanvi. The Supreme Court says, and I quote, "The Hindu branch of Dharma is influenced by theological tenets of Vedic AIIMS. The basic Hindu law emanates from Vedas and past Smritis. Judgment is authored," unquote, the judgment has been authored by Justice Arun Mishra and is certainly being seen as a reformist judgment which puts again effectively, perhaps conclusively for the future, the rights of the daughters on equal keel to the rights of a son in a family.
All right, Meenakshi Bhanja, thanks so much for bringing us those details. Top court saying once a daughter, always a daughter, son is a son till he is married. The daughter shall remain a co-partner throughout life. Daughters must be given equal rights as sons do in this country, and this will be implemented retrospectively, irrespective of the date. Earlier, that time deadline was 2005, and only after that big change now being brought in by the Supreme Court. Let's move on to the other big story that the whole world is talking about, and that's Russia's claims about having found the vaccine, developed the vaccine to tackle coronavirus. Russian President Vladimir Putin today made this announcement saying that they have developed the first COVID vaccine in the world. Not only that, he actually went on to say it's even been administered to one of his own daughters, perhaps for people to have the faith that this is serious, and he has complete faith in it. But of course, what does the world have to say? WHO is approaching this issue a little cautiously. They are wary of it right now. In fact, WHO says they're holding talks with Russia on this new vaccine because WHO had made it clear that pre-qualification of any vaccine would include rigorous review and assessment of all data, which doesn't seem to have happened in this case, at least by the International World Health Organization. So that's the big comment coming in from WHO. We've all been wondering to what extent can we breathe a sigh of relief, take this claim seriously. Well, this is what the World Health Organization has to say about it.
Antonia, really, I can just say that we are in a close contact with the Russian health authorities, and discussions are ongoing with respect to possible WHO pre-qualification. of the vaccine. But again, pre-qualification of any vaccine includes the rigorous review and assessment of all required safety and efficacy data.
And before we wrap up, here's a bit of tragic news coming in, a little bit of a heartbreak for many in our country. With news coming in that legendary poet Rahat Indori is no more. He passed away at a hospital in Indore after suffering 2 heart attacks. He had also tested positive for coronavirus. Vinay Tiwari joins me actually on this. Vinay, a lot more. He was a poet, of course, a songwriter, wrote even for Bollywood, but he was a lot more than that.
Oh, yes, absolutely. I mean, look, Rahat Indori himself used to go to many mushairas and he would often recite something which was an epitaph for himself. I mean, he would say, कि मेरे जनाजे पर लिख देना यारों, मोहब्बत करने वाला जा रहा है. And what he was, so in many ways, his Urdu Shairi got interpreted as something which was about romance, and he was a romanticized person. But his contribution to the world of Shairi, to the world of poetry, and to the world of the general cause of bringing audiences back was much, much bigger than what it seems to be. Principally, Tanvi, 2 big impacts that he left. With the advent of technology, the whole idea of mushairas was supposed to be something as a product of a bygone era. People weren't really going to the auditoriums to watch or to hear mushaira and Kavi Sammelans. Rahat Indori in the last 15 years brought back those audiences, and I think there was just one other big difference in those audiences. This was for the first time that you saw youngsters coming back to the audience, which was something which was not happening for a long time. I mean, his style, his demeanor, his attitude that he brought in the way he recited his shairi was what brought people back. And it was his attitude. It was a bit of an anti-establishment balladeer in Urdu. It was his consistency about taking on the establishment irrespective of who it is, including the Urdu poetry establishment, so to speak, was something that really endeared audiences. And I think just like in Hindi poetry, Kumar Vishwas is credited with bringing youngsters back into the popular stream. If you see IITs or IIMS or various other institutions which hold such sammelans, similar credit must go to Rahat Indori, who at his age, at the age of 70, rediscovered himself and actually became a very, very popular shair even amongst youngsters, Tanvi.
Yes, and perhaps, something that even connected with the generation of today, was the revolutionary sentiment in some of his writing, Vinay. That's something that youngsters always connect with, and it's something which is also inherent to a lot of Urdu poetry, isn't it?
Oh, yes. I mean, look, he was a very accomplished man. I think a lot of people don't realize he was actually a professor of Urdu. And Madhya Pradesh's connection with Bollywood and the world of arts is very legendary. I mean, I don't know how many people realize this, but a very large number of Bollywood legends, the Asha Bhosle and Lata Mangeshkar, the sisters, Ashok Kumar, Kishore Kumar, all of them actually were from Madhya Pradesh. They were born there. Even the Khan brothers were born in Indore because Salim Khan used to be from Indore. But I think no one left the impression of the largeness quite like Rahat Indori. And he not only revived the concept of mushairas and Kavi Sammelans in India, but he probably became the most sought after global shair. I mean, the number of concerts and performances that he attended abroad was sometimes more than what he would do in India. So he was a much in demand shair and somebody who spent his first 30 years of life doing academics, the second 15 years or so writing, and in this last 15 years or so brought back audiences into auditoriums, which was possibly the best thing he could have done in terms of popularizing what many thought was a dying art and something that was no longer popular in the age and era of digital access to content in all forms, Tanvi.
Well, indeed, a great loss, and many in the country tonight mourning this loss. One more taken away from us in this horrible year that all of us are witnessing. Thank you so much, Vinay, for joining us. And as we wrap up this edition of the Urban Debate, viewers, I just want to tell you one thing. I want to highlight that on 15th August marks 2 months of the deadly clash that took place between the Indian and the Chinese where we lost 20 of our brave soldiers in the Galwan Valley. This Independence Day, Times Network is proud to put together a special documentary named Gallantry at Galwan, A Tale of Valor, as a tribute to the martyrs of Galwan who made the ultimate sacrifice. So don't forget to tune in on 15th of August at 1 p.m. on Times Now, Mirror Now and Times Now World.